Hi, I'm Rebecca Ferguson. Today we're going to be presenting on the Substance Abuse and Mental Health Service Administration models for drug prevention. In this presentation, we will discuss programs based on their cost, training, and implementation. The three models evaluated in this presentation are the Boston Consortium model, the Matrix model, and the Chestnut Bloomington Adolescent Outpatient and Inpatient Treatment model. The Chestnut Health System of Bloomington outpatient and outpatient intensive treatment are for youth ages 12 to 18. The program was developed over 14 years to address the needs of adolescents suffering from substance abuse. The treatment programs are based on 4 therapeutic frameworks for both emotional and behavioral change. Treatments involve both the patients and their families, and the 2 primary treatments are based on skill building and counseling. Skill building emphasizes life skills, relapse prevention, self-esteem, family issues, as well as individualized treatment plans. A group counseling session gives adolescents an opportunity to discuss personal issues with their peers. Counseling sessions occur weekly for at least 35 minutes. Also, the staff of the program are linked with more than 80 agencies in the area, including hospitals and criminal justice systems. All staff members are required to have a license as well as a certification for alcohol and drug counseling by the 2nd year of employment. The cost for the program is $300 per person for 2 days. The Chestnut Bloomington model involves behavioral changes and a lot of peer resourcing. Because of this, I would say this model is based off of the peer resource programming model. This involves adolescents helping each other and serving as positive role models when it comes to experiencing a healthy drug-free lifestyle. For this program to work, the patients need to be actively engaged, involved with peers, as well as be able to discuss health-related behaviors in a safe environment. In summary, the Chestnut Bloomington model allows adolescents to discuss personal issues with their peers and help each other out by providing personal feedback and ways to help deal with the problem.
And I'm going to talk about the Matrix model today. This is an intensive outpatient program for people suffering from substance abuse age 18 and older. Patients in this program go through multiple interventions including group support, relapse prevention groups, and counseling. 16 weeks of urine and breath tests will benefit the clients in keeping them clean. The most important about this program is people actually learn information about the drugs and themselves during this program. They learn their whole self again, and they learn information about the drugs to inform them of why their bodies are reacting like this and such. The program varies from each person. It's $500 and up. It can go up to $2,500. And this model I like in particular because it builds self-esteem. That's the most important thing about this model, and that's what people need who are addicted to drugs. Boston Consortium model. The Boston Consortium model is a trauma-informed substance abuse treatment for women, and the program provides sets of treatments specifically for minority women and women with low income. And after assessment, a treatment plan is created for the women and placed into appropriate services where they can focus on their specific mental health disorders. BCM is known for their 5 skill-building modules, one of them being HIV and AIDS prevention. And some of the other models include women with leadership training, economic success and recovery, pathways to family reunification and nurturing programs for the family. The curriculum manually, which is required for each woman, costs about $140 per woman. On site, 8 days of training increases this price for $20,000. And finally, the estimated cost for implementing BCM is around $3,500 per patient with a variety of treatment plans already in place. BCM promotes family involvement, leadership programs, economic success, and other internal and external developmental aspects. All of this can prevent future risks of substance abuse.
Prevention specialists should not discriminate against service recipients or colleagues based on age, gender, race, or economic conditions. The BCM model breaks a few violations due to the fact that the program is only for women of minority or low income. In addition, the Chestnut Bloomington model also violates the code because it only serves patients who are adolescents between the age of 12 and 18. The Matrix model appears to be the only code of ethics which follows it to a certain degree, due to the fact that it only discriminates against younger adolescents. They don't allow younger adolescents into their program. All programs could use a little adjustment in order to become more susceptible to individual differences and render services in order to provide information sensitive to differences due to age, race, gender.